Hello. My name is Kristen Marie Reina, and I'm a student nurse from Southwestern University FINMA. And for today's video, I am going to perform a return demonstration on the assessment of the abdomen. So prior to performing these procedures, you have to gather all the equipments that you'll be needing and perform proper hand hygiene to reduce transmission of microorganisms. Good afternoon.
Good afternoon.
Can I come in?
Sure.
Okay. Okay, so my name is Kristen Marie Reina. I'm a student nurse from Southwestern University FINMA, and I'll be here to assist you in all of your needs and take care of you today. So since you don't have an armband with you, can you please verify your full name and date of birth for me?
I am Miss Rosemary Reyes. I was born on February 10, 1960.
Okay, good. So what would you like me to call you po?
Miss Rose.
Okay, so Miss Rose, I'll be doing an assessment on your abdomen in order for me to identify if there are any alterations or problems in your abdomen to prevent further complications. So this assessment should take about 15 to 20 minutes. So does that sound okay to you?
Yes.
Okay, good to hear that. Okay. Okay, so for your privacy, what would you prefer? Lock the door or just leave it as it is?
Lock the door.
Okay. Okay, so Miss Rose, I am going to assist you in an appropriate position. Okay. Okay, so I will lay you down flat in a supine position and raise your head a little bit. So keep your arms at your side. And then I will drape the patient and cover the areas that are not included in the assessment. Okay, so Miss Rose, with this assessment, I need to have an access on your abdominal and groin area. So is that fine with you?
Okay.
Okay, so before we proceed, I would just like to ask a few questions. So do you feel any pain on your abdomen?
No.
Any constipation or diarrhea?
No.
Have you noticed any changes in your appetite?
No.
Any problems urinating, such as pain or burning sensation?
No.
Okay, good. Have you already voided?
Yes.
Okay, great. That's good to hear. Okay. So now I'll proceed in assessing the abdomen of the patient by inspecting first the four quadrants. Note the skin color, the contour, the symmetry. Observe for any pulsations as well as the umbilical area. Okay? Okay. So I will just expose the abdomen of the patient. Okay. Okay, so upon inspection, the abdomen is flat and symmetrical. I don't see any scars, lesions, or rashes. No dilated veins, distensions, or any enlarged organs as well. The umbilicus is midline without any herniation, which is a normal finding. Now, if distension is expected and observed, then you have to locate the highest available point of that distension, and then you have to measure it by placing a tape measure around it. Okay. Next, I'm going to auscultate the abdomen of the patient in the four quadrants, and I'll be using a systematic approach in a clockwise manner. So for this procedure, I'll be using the diaphragm of my stethoscope, since this is used to assess for high-pitched tones such as the vowel sounds. Okay. First, I will just warm it. Okay. And then I will start in the right lower quadrant. Okay. So I'll start here since the vowel sounds are always present in this area. So I am listening for the vowel sounds for frequency and character, and I'll be And I'll be listening for each quadrant for 1 full minute. Okay, moving on to the right upper quadrant. And then to the left upper quadrant. And lastly, to the left lower quadrant. Okay. So upon auscultation, soft gurgling or clicking sounds are heard, which is a normal finding. Now, the normal vowel sounds is actually 5 to 30 vowel sounds per minute. And if you heard 34 vowel sounds per minute or more than that, then this is classified as hyperactive vowel sounds. So there is an increase in gastric motility. So this means that the intestinal activity is faster than normal. And this is often heard when patients have diarrhea or after eating. And if you heard one vowel sound for every 3 to 5 minutes, then this is classified as hypoactive vowel sounds. So when we say hypo, it means low. So there is a decrease in gastric motility and the intestinal activity is slower than normal. And this is often heard and often occurs when the patient had undergone abdominal surgery or take any certain medications. And take note that this is also normal during sleep. Okay. Now, what if you heard no vowel sounds upon auscultation at all? Then you have to continue to listen for the vowel sounds for 5 minutes. So now that I'm done auscultating the 4 quadrants of the patient for assessing the vowel sounds, I will now proceed in auscultating it again to assess for the vascular sounds, and this time I'll be using the bell of the stethoscope since this is used to assess for low pitch tones. So I'll be placing it in the aortic artery of the patient. Okay. Okay. So I am listening to your major arteries such as aorta to assess if there are any sounds or bruit. Okay, so upon auscultation, I don't hear any sounds, which is a normal finding. Now, if bruit are noted and heard upon auscultation, so this suggests that there is a disturbances in the blood flow that is caused by arterial stenosis. So you have to take note of that. So now that I'm done auscultating the vowel sounds and the vascular sounds of the patient, I will now proceed in percussion. So Miss Rose, I'll be tapping lightly your abdomen, and this procedure is called percussion. So is that okay with you?
Okay.
Okay. So I will use my 3 fingers, my index, middle, and ring finger, and assess for the abdominal tone in each 4 quadrant. Okay, so upon percussion, tympani sounds are heard in all 4 quadrants, which is a normal finding. So this indicates that the air in the intestine are rising. So this is a normal finding. Now, if you note a dull sound upon percussion, then this indicates that the patient has distended bladder, fluid, or mass. So that is why it is important that you ask and instruct the patient to void prior to performing the assessment. Okay, so now that I'm done percussing the abdomen of the patient to assess for the tone, I will now proceed in palpation. So, I'll be using two approaches in this procedure. One is light palpation and the other one is deep palpation. Okay. So I'll be assessing if the patient felt any tenderness or pain upon palpation. So I will use the palmar surface of my hands and feel for each quadrant if there are any tenderness or discomfort noted. So Miss Rose, do you have any pain on your abdomen?
No.
Okay. So it is important that you ask the patient first prior to performing the procedure if the patient felt any tenderness, so that you have to avoid palpating the area first, the affected area, upon palpation. Okay. Okay. So since the patient felt no pain in the abdomen, I will first palpate the right lower quadrant. Okay. Moving on to the right upper quadrant. Do you feel any pain?
No.
Okay. Then, in the other side, in the left upper quadrant. Any tenderness?
No.
Okay. Lastly, here, in the left lower quadrant.
No.
Not at all?
Not at all.
Okay, good. So upon palpation, no signs of tenderness or pain noted, which is a normal finding. So next, I'll be doing the second approach, which is the deep palpation on the four quadrants of the abdomen of the patient. And for this procedure, I'll be using the two palmar surfaces of my hands. Okay. So I will start off in the right lower quadrant. So I am feeling for the cecum, the appendix, the right ovary, and right ureter. Moving on to the right upper quadrant. Here I am feeling for the liver, the gallbladder, the duodenum, the right kidney and adrenals, and part of the ascending and transverse colon. On the other side, at the left upper quadrant. So here on the other side, I am feeling for the stomach, the spleen, the left lobe of the liver, left kidneys and adrenals, the part of transverse and descending colon, and lastly, on the left lower quadrant, I am feeling the part of the descending colon, the sigmoid colon, the left ovary, and the left ureter. Okay, so upon palpation, no signs of tenderness or pain noted, and no guarding movements as well, so this is a normal finding. So now I'll proceed in assessing the rebound tenderness of the patient, and I'll be using the tips of my finger and deeply palpate the abdomen to assess if there are any tenderness or pain noted and if there are any facial grimacing on the patient's expression. Okay? Okay, so Miss Rose, do you feel any pain? Okay, and then I will withdraw my hand rapidly. Okay, good. Now on the other side, do you feel any pain? Okay, so upon palpation, no signs of tenderness or pain noted. Therefore, the patient is negative for rebound tenderness, which is a normal finding. So, if you note any facial grimacing or guarding movements and verbalization of the pain upon palpation, then this indicates that the patient is positive for rebound tenderness. So, this is a sign that the patient has peritonitis, which is an inflammation on the peritoneum, or aneurysm. So you have to take note of that. So now I'll proceed in palpating the femoral arteries of the patient. Okay, so Miss Rose, I need to have an access on your inner thigh area. So is that okay with you?
Okay.
Okay. I will just exposing the inner thigh area in the groin area. Okay. So I will locate the femoral arteries of the patient in the groin area. Okay. And the anatomical location of that is that it is between in the anterior superior iliac spine and symphysis pubis. Okay. So this is just in the mid-inguinal point. Okay. Okay? Okay? So sometimes deep palpation is necessary to feel for the pulse. Okay, comparing it to the other side. Okay, good. So upon palpation, bilateral femoral pulses are equal in terms of rate and rhythm and strength as well. So this is a normal finding. So in assessing the pulse of the patient in the femoral pulses, you have to assess it based on the grading scale from 0 to 4. So if you felt no pulse at all, or if there is an absence of femoral pulses, then you have to rate it as 0. And if you felt barely palpable femoral pulses, then this is rating or rated as 1. So and then so forth. So you have to take note of that. So now I'll proceed in auscultating the femoral arteries of the patient. And for this procedure, I'll be using the diaphragm of the stethoscope and listen for the pulses. Okay, just warm my stethoscope. Comparing it to the other side. Okay, so upon auscultation, the pulses are equal in normal. They're symmetrical as well. I don't see any unequal femoral pulses, which is a normal finding. Okay, so now that I'm done assessing the abdomen of the patient as well as the femoral arteries, I will now proceed in assisting the patient in changing into a new patient gown and assist her in a correct and a comfortable position. Okay, so Miss Rose, okay, just assist you. Okay. So there's a bathroom right there. You can change into a new patient gown in order to maintain cleanliness. Okay, so I'll assist you. Okay. And then I'll perform hand hygiene with the use of 7% alcohol solution to reduce transmission of microorganisms. Okay. Okay. I'll just arrange back the linens. Okay. And then I will document all the findings that I have gathered in this assessment and discuss it to the patient if necessary.